That crowd is a little more obedient than I would expect a free market bunch to be. But I'm glad y'all are here. I want to welcome you to the first, but by no means the last, annual conference of the Free Market Medical Association. My name is Brandon Dutcher. I'm the Senior Vice President at the Oklahoma Council of Public Affairs, which is a free market think tank just a mile that way. And I have the privilege of serving as the MC for the conference this weekend. My organization, OCPA, was founded 21 years ago by Dr. David Brown, who is a retired orthopedic surgeon here in Oklahoma City, who's also the longtime board chairman and now chairman emeritus of the Heritage Foundation. And Dr. Brown has long lamented the increasing government intrusion into medicine and has long been a fan of Dr. Keith Smith and Dr. Steve Lantier and the work they're doing here. So it's a real honor for me to be able to MC the proceedings. My job basically is just to, I would say, keep the trains running on time, but that has a whiff of statist central planning to it. And this is, I'm sure, more of an Uber and Lyft crowd. So no Amtrak. I'll just try to share information and serve as a good host. If you do have questions, Meg is actually the repository of all information, and she has a green tag that says, "Ask Me." And if you see her or any of her team that with the "Ask Me" sticker, that's where you can get information. To get us underway, let's start with some opening remarks from one of the founding members of the Free Market Medical Association, Mr. Jay Kempton, who is the president and CEO of the Kempton Group, which is a third-party administrator here in Oklahoma City. Jay saw this burgeoning free market medical movement happening here in our own backyard, and he instantly got it and started partnering with free market-minded providers, not only in Oklahoma and Texas, but in surrounding states as well. And he has helped his self-funded clients save millions of dollars in just a few years. And I'm sure he would tell you this is just the beginning. So to help get the conference underway, please help me welcome Mr. Jay Kempton.
Good afternoon, everyone. Welcome. We have quite a few folks that are from out of state and a lot of us from around the state. But we wanted to welcome everybody into Oklahoma City and the beautiful Skirvin Hotel. I was asked by my other two partners that maybe make some opening remarks. I was like, I don't know if I'm really qualified to do that, because we're looking at making opening remarks for a brand new association at their inaugural meeting that is playing host to providers and providers that are actually selling healthcare goods and services, employers that are buying healthcare goods and services, and those two entities have really not been in the same room talking about how to make healthcare more efficient in a long time. So this was kind of a inaugural addresses. But I thought I might start my opening remarks by just kind of telling you all my story of, and everybody's going, oh, so some of y'all that have already heard it. But tell you a little bit about my story, because I think that a lot of the folks here in the audience, whether you be a physician, a facility manager, or an employer, or another TPA or broker, would probably have your own kind of first story, some sort of an event that caused you to say, there's got to be a better way of doing healthcare. There's too many layers, there's too much complication. I'm going to share my experience. I'm an independent third-party administrator here in Oklahoma City. There's not very many of us left. I think we're down to 3 or 4 in the state. But because we are independent, I'm not really beholden to anybody except for my clients. I work directly for my clients. All of my clients are self-insured employers that have chosen to step away from the commercial insurance marketplace and self-fund their benefits. Because of that, I feel like I was in a position to, we work exclusively for the benefit of our clients. And as you all know, healthcare costs are rising so much faster than wages. We've all heard, we watch TV, we're all very in tune with the healthcare crisis that it is. But me and my business, I'm looked at as, okay, well, what are you going to do about it? How are you going to help us out, Kempton? You're the one that we hired to advise us in this area. And for too many years, the biggest feature that most benefit plans had out there, other than plan design, was the managed care industry. The PPOs, the HMOs, the disease management, case management vendors. Also out-of-network repricers, and there's a whole slew of vendors that administrators such as me we have all these tools at our disposal. Probably the one that I was the most annoyed at was probably the PPO organizations. We've been in business for 45 years. This is our 45th year in operation. And so we still have quite a bit of collective memory in my firm of how medicine was done prior to managed care, prior to PPO networks. And so we have a pretty good handle and pretty good awareness of what things should cost. And we've always been one of those TPAs that, some of you medical providers probably cringe, because we're the guys that always wanted the itemized bill. We always wanted to actually look at the claim in a detailed fashion. We're also one of those providers, one of those TPAs that looked at if there was a orthopedic implant that was being placed, we wanted to see a purchase invoice, so we make sure that it was reasonable. We were those guys, but we saw through the years what the PPO networks had done, and they were essentially, they ended up becoming a broker of pricing. They were a big layer between the buyer and the seller. The way that business model works, the PPO business model works, they're not working for their client. They're not working for the employer's benefit, and most of the time they're not working for the provider. It's sometimes kind of a mix, but they're definitely not doing what they had advertised to the ultimate supporter of them, which is the benefit plan. So we saw a lot of frustration dealing with the networks, the whole percent off build charges, shell game that's out there. We would see charges that were very much inflated. It's just so the network could show us a bigger discount. You all know how that game is played. But we got very desperate about 4 years ago and said, this is just becoming out of control here. Everybody that is in my world is choosing a network based on who's got the best discounts. But, it's easy to show a big discount, if there's no control on the actual cost. So we were very frustrated, and so we said we're going to start stepping outside the box. And one of the things that we started doing, like I said, desperate times calls for desperate measures, and so being an Oklahoma TPA, we decided to start investigating medical tourism. That's the concept where you send a patient to Mumbai, India, and have that heart valve replaced. We did about a year's worth of research on that, talked to a lot of the facilitation companies that did that, and learned quite a few things. Some of the things that we learned that were kind of revolutionary, at least from my perspective, was these were medical providers that were international that it didn't take long to realize that they were actively competing for my client's healthcare business. And they were competing for that business just like the hardware store competes for that business. In other words, we would look over all these brochures that talked all about their quality and why we should choose their facility. It wasn't just quality, but it was accommodations, and it was kind of the intangible. And then they also talked a lot about price and outcomes. We thought that was pretty refreshing. The pricing was also pretty amazing. The pricing was very, very attractive. They were able to make the quality value proposition to us where we felt comfortable with the quality. But one of the other things that we took away from that was that we knew what the cost of a hip replacement was going to be before the patient ever got on the airplane. And it didn't matter whether they were young, old, sick, healthy, fat, thin. We were able to know the price up front. And so we started introducing the idea of medical tourism about 4 or 5 years ago with some of our employer groups. And they were tracking me. They understood kind of the problem, and they thought, well, this might be an interesting solution, and they were very engaged. But one of the guys out on the floor said, well, Mr. Kempton, this is great, but would you go to Istanbul, Turkey, to have that your hip replaced? And that's when this great idea of mine just kind of came crashing down, because I had to honestly answer, I get nervous just going to Houston. And so, no, I probably wouldn't do that. At the end of that users group meeting that we had for our clients, one of our clients just came up to me and said, there's a guy that's a physician here in Oklahoma City that you ought to talk to. He rants and raves more than you do. He's very frustrated. He's out there. You probably get along with him. He's actually a neighbor of mine, and he's a physician. He's an anesthesiologist and runs Surgery Center of Oklahoma. And so I said, well, okay, what the heck? And being in the TPA business for as long as we had, we knew about this facility. They were in our PPO network, right? So we had patients that went there, but never really saw anything that was really that stand out about Surgery Center of Oklahoma. They were just another network provider, and the pricing was just kind of in line with everything else. But I made an appointment to go meet this individual at his surgery center. It was a Surgery Center of Oklahoma, and that person was Dr. Keith Smith. And I had been in a lot of meetings with providers trying to do some direct contracting with them, and I always heard kind of the same thing. Well, what kind of volume are you going to bring us? Oh, let's look at your benefit plans. Let's look at the kind of patients that you're going to send us. Are they, have a lot of comorbidities, da-da-da-da-da. And I would also say, I would also hear that, well, based on your volume and where you at, you're probably the best pricing you're ever going to get from this facility is through one of the rental PPO networks. I was used to hearing that. And being an independent TPA, it was pretty clear to me that from the PPO network's perspective, and also, quite frankly, some of the larger providers out there, that they had already picked the winners and the losers. And they were going to pick that through pricing. And, the little guys, whether it be a little physician clinic or a smaller facility or a TPA, you were already kind of slotted in. You were where you were supposed to be. And if you wanted to step out from that, there was really no way unless you just submitted. But when I sat down with Dr. Smith, one of the first things that he asked me is you work for one of those PPOs? I said, no, I'm not with a PPO. Well, you're not a Blue Cross guy, are you? I was like, no, I'm not a Blue Cross guy. I'm a TPA. I work for my clients. We kind of hit through that. And he said, well, we've offered everything that we do here at the Surgery Center. We've bundled it, and it's on our website. And that clicked with me. That's exactly what they were doing internationally. But it was right here in my backyard. And so, well, yeah, but don't get too excited about that pricing, because it's not good for, if you have insurance, it's not any good. You've got this PPO deal over here. I said, well, we represent self-funded employers that are paying these claims right out of their revenues. So if you think about it, they're kind of like cash-paying customers. The 20% that the patient's paying is coming out of the patient's pocket, but the 80% that's coming out of the employer, that's coming out of the same pocket that's paying that employee's paycheck. So he and I hit it off, and he said, well, and I also, at this point, I felt that this was a very ironic conversation, because other facilities were saying, to get the best pricing out of me, you got to go through the network. And I had this guy saying, if you're with a network, you get the dog price, at least at my facility. And I was like, we may have something here. I've got some of my team members that are here in the audience that helped with the convention, and they know that I'll do this from time to time. Being the CEO, sometimes, we'll promise things that we don't have any idea how we're going to deliver. And so I kind of took a gamble, and now that Dr. Smith and I are friends, we can kind of laugh about it. But as I was looking at that pricing, and I had a pretty good handle on the kind of differentials that we were talking about, and it was pretty amazing, and it was bundled. I said, well, if I could somehow make my employees and my employers, when they come to see your facility, if I can make that transaction look, smell, and taste like a cash transaction, could we have access to that pricing? And we talked a little bit more, and we essentially on a handshake, we decided to give that a whirl. Now, when I'm on the car ride back to the TPA, I was going, oh God, I don't know how I'm going to do this. I'm going to have to probably waive deductibles, waive copays, waive co-insurance. And just for the other TPAs that are in the room, y'all know that just doesn't feel right. I mean, we're not supposed to do that. That's going to cause more utilization. It's going to cause all sorts of problems. But we started to do that. We started to pay the bills, the bundled charges at Surgery Center of Oklahoma at 100%. And it kind of was the domino that kind of kicked off, at least here in Oklahoma City, I feel like it kind of kicked this movement off. I don't think that's too bold of a statement. But what started out as our little experiment, we started to introduce some market forces into the healthcare arena here in Oklahoma City that had never really functioned. And I got a call from the next door neighbor from Surgery Center of Oklahoma about 3 months after we started doing that. And that neighbor is McBride Orthopedic Hospital. And they were very interested in what we were doing because they had had surgeons come to them and say, you know, I just had a patient up and cancel my procedure that I had scheduled for tomorrow at 9:30 because they're going over here to Surgery Center of Oklahoma because this Kempton guy is paying it at 100%. What gives? And so that started a conversation that we had with McBride Orthopedic Hospital. And it was an interesting conversation because I had Mark Galliard, the CEO of McBride. He actually asked my permission. He's a great partner of ours as well, but back in those early days, he said, well, can we do this also? And I kind of noticed that, you know, hey, we might have just seen the birth of something. Because I just had a hospital administrator ask me if he could compete with his competitor, honestly and openly. And I said, without a doubt, you don't need my permission. And so that was the beginning of the competition. Flash forward to today, I think my 15 minutes are up. But flash forward today, the Kempton Group, we're doing business with 19 other facilities that are operating in this exact same fashion. When we first started doing this with Dr. Smith, we thought it was going to be for certain general procedures and orthopedics. And then we started seeing it as time went on, we started seeing it to expanding to cardiac, inpatient cardiac. We started seeing it to expand into oncology, more and more general procedures, more imaging. And so now, my goodness, you know, we have hundreds and hundreds of procedures with facilities in Oklahoma, Texas, and a couple other states in areas, bundled cash pricing that is out there that for procedures that we never thought could be bundled. The employers have jumped on this extremely aggressively. And the reason employers like it is because it feels like this segment of their business, they're able to run and manage and anticipate much more like every other part of their business. I had an Oklahoma employer in the northern part of the state say, you know, we buy mud pumps and Ford pickup trucks and pipe fittings, but we buy healthcare differently than everything else that we buy because of these providers that are willing to kind of step across this line, cut out all of the layers. I'm going to start sending my employees to that facility and incentivize them to go there because it looks like a free market. It looks like the way that they buy everything else in their business. So it was the beginning of a great adventure, and Dr. Smith and I and Charlie Sauer decided that as time went on, we have a lot of employers have come to us talking about how can we do this. A lot of providers have come to us and say, how can we do this? We've had other brokers, other TPAs come to us and say, how do we do this? And we decided we need to get all of these radical renegades in the same room and start talking about what's working, what's not working, and how do we move this ball forward. It simply is a more efficient way of delivering healthcare. Like we said, the 3 club members, if we were going to have a club, call the Free Market Medical Association a club, we were going to allow just 3 entities: willing sellers of healthcare goods and services, the providers; willing buyers of healthcare goods and services, which would be individuals and self-funded group health plans; and then also facilitators. Facilitators would be somebody like the Kempton Group, like the Holmes Organization. We keep the close eye on these facilitators because, we have other facilitators in our industry and they're not good for the industry, like the PPO networks and the out-of-network repricers. And so we keep an eye on us, and facilitators are there to facilitate the transaction, make the transaction between the buyer and the seller more efficient, but keep a very, very soft hand on that. Allow the buyers and sellers to interact the way they should in a free market. So with all that, we've got a great lineup of speakers, a couple of panels going on. And so we just wanted to welcome everybody and thank y'all so much for investing your time in the Free Market Medical Association.